lot busier than anybody else's right now, I would imagine, or except for Joan and Mike, of course.
Yeah. All right. It's great seeing you all. We're going to go ahead and start the Board of Health meeting for the City of Kent this 9th day of March 2021 at 5:35 p.m. Madam Secretary, would you call the roll, please?
Absolutely, thank you. We'll start with our president, Chris Wolverton.
Here.
Emily Mattern.
Here.
Jack Amrine.
Here.
Pam Ferguson.
Here.
Michelle Frederick.
Here.
Hi, Michelle.
Hello.
I didn't see your picture earlier, thank you. Louise Frederick.
Here.
Okay, great. And then for guests, we have Dr. DeJulius and Kyle Kelly from the Health Department.
Hello.
And we see Sandra Hallam on here also.
Okay.
I'm also a guest. I just wanted to come and sing the praises of the health board before you get into too many pieces of business. I don't know whether it's out of order, but because of their incredible coordination today, we were able to vaccinate some really at-risk people at the Kentway senior residence. And I cannot tell you how this is going to make a tremendous difference in the lives of these people. So I wanted to thank Joan. I wanted to thank the Portage County Health District. We were already getting cards and letters from our residents, and they are people who don't have computers, they don't have cars, they are not in a nursing home, but they are certainly, as you saw today, Joan, not independent. And so I just want to voice my tremendous appreciation for your following through, and I hope it will be the beginning of many other successful places for other seniors, particularly who are at risk. So if that doesn't disturb your agenda, I just really wanted to voice it from Family and Community Services and Jackie and all of you for working together. I think Joan will attest that it was a fabulous morning.
Thank you, Sandra. We're always willing to listen for praises of the health department.
I figured it was better to praise you than it was to come in here and say, what? No, no, but I am very, very grateful. And I thank you for giving me a few minutes. And if anything that Kentway can do, we have a beautiful spot. If you ever need a spot to do it for other people, we are certainly willing to work with you at any point. And we think this shows the incredible value of our public health department in Kent, and particularly the value when you guys work together as you did. It was brilliant, and you were just such a great team today. I was so impressed.
Thank you. We were glad that we were able to work together and make that happen for the residents at Kentway. Absolutely. Thank you.
So go on, be good, do good, and have a great meeting. Thank you for letting me.
Thank you very much. Bye-bye. We'll go ahead and ask for a motion to approve the minutes of the previous meeting.
So moved.
Pam, is there a second?
Second.
Thank you, Emily. Is there discussion on the minutes of the previous meeting? Hearing none, the motion is to approve the minutes of the previous meeting. All in favor, aye.
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 Opposed? Motion carries. Thank you. This is normally where we would ask our guests to say hi, and we give open comments time. If you are scheduled on the agenda, we certainly will wait to hear you then, but if you just want to give your comments here, this is the opportunity as well. All right, hearing none, we'll move forward through our reports. First up is the statistical report for February. And I know it's in your packet, and if you had a chance to see it, I'll ask Joan, are there any highlights that you want to bring to our attention?
Nothing that I feel needs to be pulled out or called attention to at this time. Thank you.
Okay, thank you. I did notice we saw a couple of more indigent burials.
Yes, that's true.
What's our total number so far?
I believe we're at 4 now for the year. So we've augmented this year what we did in total last year.
Wow. So we normally, I'm hearing some feedback. We budget for 7, is that correct?
I believe it is 7. I think one time we didn't have an outline, we had 10. So that was unusual, but we're kind of for that unusual year.
You're breaking up a little bit, Joan. I don't know what's going on with your system there, but I heard that you thought it was 7, but although we've done 10 in the past.
I'm not sure if we have too many people too close together in the department with our laptops up and on, if that's causing some feedback. But I believe that we do budget for 7 indigent deaths. And I know that there was one year where we had a tremendous year and we had 10 unfortunate indigent deaths. So, yeah, but I think 7 is typically what we budget for.
Okay. Well, thank you for keeping tabs on that and serving our people in that way as well. I don't see Rose on the call. You've had an opportunity to see the nursing report and the CDR. So Joan, if you wouldn't mind giving us the health department report.
Sure, absolutely. And Rose did call just shortly before the meeting and say that she was unable to join us, but she had sent along the nursing report. So for the health department report for a COVID-19 update, we remain at risk level 3 red. We need to get under 100,000 cases per capita in order to move to the next lowest level, which is orange. In the meantime, the state has relaxed some guidance in terms of sporting events and other events that can go on. For indoor sporting events, we can have an occupancy of 25% of the given capacity, and for outdoor events 30%, but still no parades, no Easter egg hunts. They are planning to allow proms to go on and graduations to go on, but of course still following all the appropriate guidance. In terms of case counts and contact tracing, we have, in the city of Kent, there is 2,105 with 10 deaths. Our vaccine for Portage County is 14%. Our positivity rate is 4.8%, so that's great. Age in Kent for numbers of cases is 22, so that's actually gone up a little bit, which I think is interesting. It's probably not all Kent State students at this point, or that younger age group. In terms of that public health alert advisory system, we're still meeting with 2 of the indicators, which is cases per capita, as well as non-congregate care setting. All the other indicators, the 5 other indicators, we're not meeting. Our daily average of cases is about 7. That changes based on the day. And then in terms of the CDC has changed some guidance as well in terms of people who are fully vaccinated, meaning if they had a 2-shot vaccine regimen and they're past that 14 days, they're now allowed to gather with people in their own homes or places of business and not have masks on if those are their cohort. They're also allowed to gather with people and not have their masks on, and they don't have to follow social distancing, even if the other people are not completely vaccinated. So this is allowing grandparents to mingle with grandchildren where they maybe had not in the past. And then they also don't have to quarantine if they've had an exposure to a known case, as long as they're asymptomatic. So those are some exciting changes that I think.
I'm sorry, I missed it because the audio blipped. What's our immunization rate in the county?
In the county, it's now up to 14%.
Thank you.
You
got right there and it blipped out and I was like, wait a minute. Thank you.
Yeah, thanks for asking. So we are certainly seeing increased availability in terms of vaccine supply, and especially with the 3 vaccines being available now. There's a lot of plans for mass vaccine clinics. In Cleveland, there'll be a FEMA, so that will be a national vaccine clinic. And then there's several other locations that are state-run mass vaccine clinics. And then in Portage County, we're also planning for some larger scale operations as well. So we're not doing that from our department, but in support of Portage County and their vaccine, because they're getting in much more vaccine. Outside of that, we did have an opportunity to work with David Hassler from the Wick Poetry Center at Kent State University. This is a little something different, and it's a nice relief from all the stress and strain of pandemic. But he has offered a vaccine poetry project so that while people are waiting post-vaccine for that 15 or 30-minute wait time, they're given a card and they're given 4 writing prompts, so 4 ideas that they could choose one and write something down, and they can either turn it in or go to a website and upload their stanza, and it's going to be incorporated into one very large poem. So I think that it's really,
Wow.
really neat. And there's only 2 sites in the nation that are doing this, Arizona University and Kent State University. So we're really proud to help support that.
Awesome.
So that's what I have for COVID. Before I move on to anything else, I don't know if there's any questions or concerns over COVID information. Okay, so in terms, then I'll move on to food service organizations. Really not much new there. The March deadline for licensing fees was moved to July 1st, but right now we have the majority of our operators have already turned in their fees. They're staying on top of it, which I think is good. And again, we were not going to fine anybody who meets the July 1st deadline because that's in accordance to the governor's orders. We are getting multiple planning reviews in terms of change of ownership of various locations. So Justin's busy with that. And then I don't know if we want to have Kyle give his presentation now or after I finish the health department report, but Kyle Kelly was going to speak about housing inspection, so maybe I'll just skip over that and allow him that time afterwards. Nothing really new for body arts and pools. In terms of statistics, the Permidium platform seems like it's working out very well, but now what we're doing is looking at succession planning since our registrar has turned in her change in status form and her resignation letter for retirement. So her last day will be April 18th, and so we will be busy looking for a new registrar to try to fill her position. In terms of grants for COVID, we're still waiting to hear from the state so that we can get access to our sub-grant from the county for the EO21, and still working through spending down our money for the contact tracers. So we're thankful that we still have a bit of funds there to pay them and keep them on board. And then for the Mosquito Grant, we did put out our posting, and 4 individuals have already shown interest to be interns with us this summer. So it looks like, and there's 1 individual that I think is returning from last year who was a great candidate. So we're happy that they want to come back. And I think we'll have a good, although I hate to say pool of candidates since it's mosquito, we'll have a great pool of candidates. And then Mike, I don't know if you wanted to speak to the tobacco grant at all.
I'm in the process of applying for the next year of funding. That application will be due on the 29th. It will be for $132,000, which is what the state is offering us. As for this current grant, there has been some discussion with the Kent State College of Public Health to attempt to get some students in to do the compliance checks so that we can go and cash that deliverable in. They would be doing this on an internship basis, so they would be getting credit, and through a grant, those students could be getting paid as well. So there's a little bit more of an incentive for them to do the compliance check. So still in the process of doing that, but the big news is the writing of the grant for next year, which begins July 1st, 2021, and will run through June of 2022.
I'm sorry to interrupt, Joan. I just got a phone call that I need to do with something that's a personal matter. I've asked Emily to take over the meeting, and I have all the confidence that she'll do a great job. So I'll check in with you later this week, okay?
Okay, that sounds good. All right, take care in the meantime. Okay,
Bye-bye.
Okay.
Mike, when's the submission date on the new proposal? I'm sorry, I think you said it, but I didn't get to write it down.
It was the 15th of March. It's now been moved to the 29th of March.
Okay, great, thank you.
And then the last thing on my report is any update on accreditation, and I believe we're still working through that. So, but Mike, I'll turn it over to you one last time to see if there's any updates you want to provide on accreditation.
There's no additional updates other than we are still in the process of submitting the additional documentation that FAB asked.
All right, then that completes the director's report.
Okay, it looks like we have the FEP and nursing reports. If anyone has comments on those, if you got a chance to review them before.
The only thing I would offer, and of course it wouldn't be contained in this communicable disease report yet, but in one day we had 7 STI reports. So I think we could stop social distancing for sure. I was a little concerned about that. I think it was 6 chlamydias and 1 chlamydia. So next month's report very
Don't, I just drove past the fraternities on my way here, and I can tell you the social distancing is not happening.
Uh-oh. Leave it to the frats.
Okay, discussion items. We have the housing PI.
Hi, my name is Kyle Kelly. For those of you that don't know me, Joan invited me here tonight to give you guys an update on our housing program. I've worked for the health department for 9 years now. My typical duties include inspecting restaurants. I help Mike a little bit with accreditation and tobacco when possible. Of course, over the last year, COVID has eaten up the majority of my time, but one of the main programs I work in is housing. So that's why Joan asked me here tonight. So I'm going to give an update. There is a PowerPoint that Mike's going to pull up on the screen that we can follow along with, but definitely if there's questions, stop me so you can ask them.
Is everybody able to see that?
Yes.
Okay.
Okay, Mike, can you go to the next slide, please? Okay, so, sorry, the housing program overview. So basically, if you're not familiar with it, or if you're new to the health board, the purpose of the housing program is to ensure safe housing for tenants. The health department enforces the environmental health and housing maintenance code. It's a local ordinance, and we do that through inspection. So landlords are required to make repairs when code violations are identified, and our most typical ones are listed below: smoke alarms, carbon monoxide alarms, fire extinguishers, issues with means of egress. And a couple examples of that would be a landlord who maybe tries to add a bedroom in a basement or a bedroom in an attic where the tenant wouldn't have the proper means of egress in an emergency. There's pest issues, and that could be cockroaches, mice, bed bugs, squirrels, raccoons, bats, and then any other property maintenance issues that we might find during an inspection, which would be things like plumbing issues, electrical, HVAC, handrails, roof leaks, or anything similar that we would find when we're doing our inspections that a landlord would then be required to fix if discovered. We do annual inspections at each of the larger rental properties in Kent. And I ran the numbers for you just so you had an idea of how many inspections that we do. There's 316 properties and 672 buildings. The number to me that really brings the how big our program is the number of bedrooms. There's over 11,000 bedrooms that we inspect each year. And typically there's one resident per bedroom. So you can assume that 11,000 Kent residents have their homes inspected by the health department every single year to make sure that they're safe. This is not a new program. The housing program dates back to the 1970s. That's it for that slide.
Kyle, are you guys responsible for inspecting Kent State properties? Or do
The dorms are not included, but a lot of our larger student rental properties like the Province, University Edge, University Oaks, 345 Flats, those are obviously geared towards students, but they're not on university property. We do not do the dorms. Any questions about the overview? No? Okay. So basically what happened in March of 2020 is our lives were kind of brought to a screeching halt, and that included the housing inspections as well. We were concerned about the spread of COVID between tenants and inspectors. Obviously, we didn't want to send an inspector into an apartment and have that inspector become positive with COVID, but more so, we were more concerned that we as inspectors would go into an apartment and accidentally spread COVID to the tenants. That was our worst case scenario, was that an inspector would come to work asymptomatic, not realize they're positive, and potentially inspect 75 apartments that day. If we go to a large apartment complex like College Towers, it's not uncommon for an inspector to go into 75 apartments. And if you're positive with COVID, asymptomatic, you could potentially then spread that to 75 people unknowingly. So that was our biggest fear. So in March, we stopped doing housing inspections. We postponed them for about 3 months. March, April, May, and June, we didn't do many housing inspections. Obviously, like I said, to reduce the potential spread of COVID. And we also were concerned that tenants may not want us in their home. Did they view us as unwelcome intruders? So we decided for 3 months not to do inspections. We also didn't want to spread a conflicting message. So the CDC, the governor, ODH, and local health departments were encouraging people to stay home and not to go out for social gatherings or go to restaurants or schools or even work. So we thought that it wasn't a very good idea to go into their home for that amount of time. In June, we decided that things were starting to get better on the COVID front. So we started a quality improvement project that would allow us to resume housing inspections. For one, this met a FAB accreditation requirement to do the quality improvement project, but more importantly, allowed us to resume our housing inspections. It wasn't an overly complicated process. We included everybody on our health department staff was able to brainstorm and share their ideas on how they thought housing inspection could resume in June. We also included our landlords so that they understood the process, so that they wouldn't be hesitant to allow us back into their properties. The main thing we did was improve our safety protocol. So when we resumed inspections in June, we incorporated PPE that we never did before. Prior to March, we didn't wear masks to do inspections. We didn't wear face shields. We didn't take Purell with us to do inspections. But obviously with COVID, things changed and we knew we had to improve our safety protocols. So we did require masks and face shields for our inspectors. Hand washing and alcohol hand rub became the norm. We increased cleaning of our cars, our desks, our shoes, our clipboards, things like that. We also spent a great deal of time trying to educate tenants. The next slide is going to show that document, but the biggest change to our housing program was reducing contact with tenants. Prior to COVID, we would go into every single apartment. We would try and have a conversation with every single tenant to make sure that they weren't experiencing property maintenance issues. But with COVID, we felt like that was maybe an unnecessary risk. So one of the things that we did with our quality improvement project was try and figure out how we could reduce contact with tenants. So one idea Joan had was to only inspect 50% of the apartments when we went to a larger place. Like if we went to College Towers or Province, we inspected 50% of the apartments instead of all of the apartments. So that was one way to reduce contact with tenants. Another way we reduce contact with tenants is we didn't do as many re-inspections. So what I mean by a re-inspection is typically we will go into an apartment and we will do an inspection. And if there's violations, we come back in a couple of weeks to make sure they're fixed. Well, after COVID, we started to be a little more lenient on our re-inspections. We certainly wanted to make sure that the most critical violations were corrected. But one, we tried to encourage them to do it at the time of the initial inspection so that we didn't have to come back on a different date. But also we quit coming back to check less critical violations. Like if somebody had a drippy sink faucet or, a damaged ceiling tile or a loose handrail or some missing caulking, those were non-critical violations that we decided we'll just check those next year. It's not worth the risk to the tenant to have to come back in a couple of weeks to check those less critical violations. Also, we tried to time our violations we tried to time our inspections at a time when less tenants would be home. So with student rentals, the month of July, a lot of students aren't in Kent. So we tried to focus our student rental inspections in the month of July to try and avoid contact with those folks. Also, if somebody wasn't at home during the inspection, we obviously wouldn't have to come in contact with those folks. So we try to encourage people to not be home. They know what day and time we're coming. It's a scheduled inspection. So if tenants could, take the dog for a walk or go to the grocery store during the time of inspection, that would obviously reduce that inspection time. Next slide, please, Mike. So one of the things that we did with our quality improvement project was make a better effort to educate the tenants. And this is the document that we created. I did most of the content, but Mike really helped by making this attractive. He put those images and those graphics in there to make this a little bit more appealing document for the tenants to look at. But basically what this was given to every single tenant a couple of weeks before inspection so that they could make the inspection a little bit more safe, make the inspection go a little bit more quickly. You can see some of the points in this document, it should be in your packet too, is that we wanted the tenants to take a little bit of time to prepare for the inspection. So if they already had maintenance issues that they were aware of, whether it was a missing smoke alarm or something like that, to bring it to the landlord's attention ahead of time and have it resolved so that our inspection could go more quickly. Also something that you might not think about, but just it's a small task to make the inspection go more quickly is one of the bullet points on here is for the tenant to find their fire extinguisher and make it more clearly visible. If I don't have to search underneath their kitchen sink for the fire extinguisher in every apartment, I can get in and out of the inspection a lot more quickly. Again, tenants are encouraged to leave the property during the inspection. And then obviously we're going to be wearing masks as inspectors, but we're asking tenants and the property owners to also wear masks and to social distance if possible. And then you can see at the bottom of the document are just the public health guidelines for all aspects of life, not just for inspections. Wear a mask, wash your hands, increase cleaning, social distancing, things like that. And again, back to the landlords, we kept them in the loop for this decision making for inspection so that they felt more comfortable when inspection day came. And they helped us to pass this document out to all the tenants. Next slide, please, Mike. So one of the things that we were worried about when we stopped doing inspections was that we were concerned that landlords would become a little bit more complacent and violations would increase. So we were concerned that tenants would start to file a lot more complaints because we were postponing inspections and that maybe the landlords, like I said, would become complacent and that property maintenance issues would increase. But we didn't get more complaints. You can see by this chart that we averaged 41 housing complaints a year, and we actually only had 40 housing complaints in 2020. So if anything, it was right at average or just below, which I'm a little surprised about. If you would have asked me in June when we resumed inspections that complaints would stay at average, I would have not believed you. So this is just some statistics to show you that complaints did not increase in 2020, even though we thought that it might. And another thing that we thought might happen with resuming the housing inspections was that a lot of tenants would be hesitant to let us into their apartment. We expected when we would go do an inspection that a lot of people would say, I'd rather you not come in, but statistics don't show that. I don't have the numbers, but it's less than 1%. There wasn't very many people that said, you know what, I'm not comfortable with you coming into my apartment. Please come back another day or don't come in at all. There was a handful, but not a very large number. Next slide, please, Mike. And then the last slide that I have here is just a photo of one of our inspectors. This is Jason Revez in what our PPE is. You can see he has a surgical mask with a cloth mask over top of that, and then the face shield. And then we always have plenty of Purell or hand sanitizer in our pocket to use throughout the day. And that's pretty much it. Hopefully some of you were already aware of what our housing program was like before. And like I said, once we resumed inspections after COVID, most of the things weren't a drastic change. Increased PPE is no big deal, asking tenants not to be home, but only to inspect 50% of the apartments is probably the biggest change that we made. So if there's any questions, I'm here.
Kyle, this is Pam.
Hi.
Great job. Hi. I just wanted to say, first of all, excellent job being flexible in the face of the pandemic. You guys really just worked with brainstorming how to get through this. But also, I'm just floored by the number of beds in the city.
Me too.
Yeah, I never knew that. Born and raised in Kent, and I knew there were a lot of them, but I had no idea. So very interesting information. Thank you.
If there's no further questions, we can go to the Cutler Space update.
So I think this is going to be pretty brief. We're very excited that we did have a contract drawn up, and it is, I believe, with PARTA, but we also brought the contract to the city council to see if they would approve, since there's more dollars involved in terms of renting this other space. And it was a unanimous vote that while we still have some wrinkles, I guess, to iron out in terms of the final contract, that city council did approve it. So we're very happy with that. In the meantime, what the holdup is, Ron Burbick had owned that property, but since his unfortunate passing, it went to another company. And so we have to try to introduce the new lawyers to the process and to our plans and what we want to do. So it's now kind of with them in terms of what they will allow or what they will agree to. So, but at least we did jump one hurdle in terms of gaining the acceptance of city council. So I'm happy to report on that. So more to come.
That's great. First action item is expenditures and encumbrances. Is there a motion to approve these?
Move to approve.
Motion to approve.
I'll second it.
Okay, great. Thank you. Next on the action items. The 2021-2026 strategic planning document.
Hey, Emily, if I could just backtrack really quick.
Okay.
I am not positive of this, but I believe that after you get a motion to approve in a second, I think you have to ask all those in favor.
Oh, yes. Okay. All those in favor of approving the expenditures and encumbrances? Aye. Opposed? Okay, no opposed. Then we can move on to the 2021-2026 strategic planning document. Is there a motion to approve this or any discussion?
I'm sorry. I motion to approve.
Second.
Okay. All in favor? Aye.
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 Opposed? Okay, none opposed. We go to the 2020 annual report. Is there a motion to approve the 2020 annual report?
So moved.
I'll second it.
Okay, all in favor? Aye.
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 Any opposed? Okay, hearing none. We can go to the 2019 Public Health Code of Ethics. Is there a motion to approve this?
So moved.
Second.
All in favor? Aye.
Aye.
Any opposed? Hearing none, we can go to the ethics SOP.
So if I could, this is just a follow-up. For the Code of Ethics, we approved the Code of Ethics. We're getting a little bit of feedback. Can I have, if you're not speaking, could you mute your mic for me, please? Okay, there we go. So this is a follow-up to the Code of Ethics. We approved the Code of Ethics several years back. In fact, it was last formally updated by the APHA in 2002. That new code of ethics, that was action item D, is the 2019 one. So we approved to follow that code of ethics. This SOP is a requirement as part of accreditation that all policies and ethical discrepancies that the department faces or that we in the community see occurring, we will follow this code of ethics and then apply it to however way we resolve the issue at hand. So just to give a little bit of feedback, I didn't mean to send, a 30-page document about public health ethics to everybody, just for fun, light reading. But I did just want to give a little bit of context for that before we go through it.
So is this something that we need to approve again?
Yes, so you need to adopt the new ethics, which we just did, but the SOP would need to be approved.
Okay. Is there a motion to approve this?
Move to approve the ethics SOP.
Second.
All in favor, aye.
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 Any opposed? Okay, hearing none, the motion carries. Is there a need for an executive session tonight?
I could just offer one personnel update if I could. So if we could consider executive session for personnel changes.
Okay, is there a motion to go to executive session?
So moved.
I second.
Okay, now I think we do a roll call.
Okay. Chris Overton has been excused from the meeting. Emily Matter.
Here.
Jack Ham.
Yes.
Pam Ferguson.
Yes.
Michelle Frederick.
Here.
Louise Frederick. I'm sorry, Louise, I didn't hear you. Did you say?
Oh, sorry. Here. I'm getting a lot of echoing. I'm having a hard time hearing everybody.
I know I had to turn down my speaker so far that I couldn't hear anyone. It's challenging. I'm not quite sure. Okay. But I believe we did hear from everyone who's present